Did you know that your pancreas, while often overlooked, plays an important role in your body? It's very powerful and helps with digestion and keeping blood sugar in check. But what happens when something goes wrong, like pancreatic cancer? Here are 12 strange signs that your pancreas might be having trouble. Spotting these early could be a game changer, potentially saving your life. So let's get informed together. First up is jaundice. Notice your skin or the whites of your eyes turning yellow? It's a classic sign that your pancreas might be struggling. Jaundice occurs when there's a buildup of bilirubin, a yellow pigment produced during the breakdown of red blood cells. The liver usually processes bilirubin, but if the bile duct is blocked by a pancreatic tumor, bilirubin can't be processed and starts to accumulate in the body. This accumulation is what turns the skin and eyes yellow. Jaundice is often one of the first and most noticeable signs of pancreatic cancer, especially if accompanied by itchiness, which results from bilirubin depositing in the skin. It's a clear signal that something is terribly wrong with your liver or pancreas, and it warrants immediate medical attention. Early detection of jaundice can lead to quicker diagnosis and treatment, potentially improving outcomes for those with pancreatic cancer. The next is sudden, unexplained weight loss. If you're dropping pounds without trying, it's time to listen to what your body's saying. Unexplained weight loss, particularly when you lose about 5% or more of your body weight over 6 to 12 months without a change in diet or exercise routine, can be a significant warning sign of pancreatic cancer. This weight loss can occur because the cancerous tumor in the pancreas interferes with the body's ability to digest and absorb nutrients from food. Additionally, cancer consumes a large amount of the body's energy supply, and the immune response to cancer can also increase metabolism, further contributing to weight loss. For example, if someone weighs 200 pounds, a 5% weight loss would be 10 pounds lost without trying. This symptom is especially concerning when accompanied by other signs on this list. If you experience such weight loss, it's crucial to consult a healthcare professional to explore the underlying cause. Many experience a dull pain in the abdomen or back. This pain can be a whisper from your pancreas that something's not right. This type of pain, often starting in the abdomen and radiating to the back, is reported by approximately 70% of pancreatic cancer patients. The discomfort is usually a dull ache that feels worse when lying down and may slightly improve when leaning forward. The pain arises because a tumor in the pancreas can press on nearby organs and nerves. As the tumor grows, it can block the digestive tract or invade nerves, intensifying the pain. In the early stages, the pain might not be constant and might occur more often after eating or at night. If the pain persists for more than 2 weeks, especially if it's accompanied by other symptoms like jaundice or weight loss, it's critical to seek medical evaluation. Early intervention can be key to managing symptoms and improving outcomes. Pay attention to your stool. Oily, floaty, or unusually smelly stool can indicate your pancreas isn't digesting food properly. This symptom is observed in about 50% to 60% of pancreatic cancer patients. Normally, the pancreas produces enzymes that help break down fats. However, if a tumor blocks those enzymes from reaching the intestines, fats aren't absorbed, but instead are excreted, leading to stools that are more oily, float due to the fat content, and have a particularly foul odor. Also, the stool might look lighter, like pale to clay-colored, because the bile duct might be blocked, stopping bile from reaching the intestines and giving stool its brown color. Observing these changes in your stool over a period of a few weeks, especially if accompanied by other symptoms like abdominal pain or jaundice, warrants a consultation with a healthcare provider. Early detection and diagnosis are needed for effective treatment and management. A sudden diagnosis of diabetes, especially in adults, can be a red flag for pancreatic issues. Interestingly, up to 25% of pancreatic cancer patients receive a diabetes diagnosis, approximately 1 to 2 years before the cancer is detected. The pancreas plays a key role in regulating blood sugar levels by producing insulin. A tumor can interfere with the pancreas's ability to produce insulin, leading to an increase in blood sugar levels and, subsequently, diabetes. This sudden onset of diabetes in individuals without a history of blood sugar issues, particularly those over 50, should prompt further investigation into pancreatic health. If you or someone you know was just told they have diabetes without the usual risk factor, like being overweight or having a family history of diabetes, it is important to talk to your doctor about the possibility of pancreatic cancer. This is especially important if there are other symptoms like weight loss or abdominal pain. Early screening and tests can help in identifying the underlying cause and potentially catching pancreatic cancer in its earlier stages. Finding yourself suddenly off your food? A loss of appetite can be a subtle sign of pancreatic cancer. This symptom is particularly concerning when it's a significant change from your normal eating habits and is accompanied by other symptoms like weight loss or abdominal pain. Approximately 30% to 60% of pancreatic cancer patients report a decrease in appetite or a feeling of being full after eating only a small amount. The tumor's impact on the pancreas can disrupt digestive processes and hormone levels, affecting your appetite. Additionally, the body's response to the cancer can produce substances that suppress hunger, further contributing to a decrease in appetite. If you notice a persistent lack of interest in food or find yourself feeling full much quicker than usual, especially if these changes are sudden and unexplained, it's important to consult with a healthcare professional. Early detection of pancreatic cancer can significantly improve treatment options and outcomes. Nausea or vomiting, particularly after eating, can also signal trouble in the pancreas. This symptom, experienced by about 35% to 45% of individuals with pancreatic cancer, often occurs when a tumor blocks part of the digestive tract, making it hard for food to pass through. This blockage can lead to a buildup of stomach contents, resulting in nausea or vomiting. While these symptoms can be common to many conditions, their persistence, especially when combined with other signs like jaundice or abdominal pain, should not be ignored. If you're experiencing unexplained nausea and vomiting, particularly after meals, it's crucial to seek medical advice to rule out pancreatic cancer or other gastrointestinal issues. Early consultation can lead to early detection, which is key to managing pancreatic cancer. If your doctor notes an enlarged gallbladder or liver during an exam, it could be due to a blockage from a pancreatic tumor. Some people feel this physical sign as a lump in their upper abdomen on the right side. Imaging tests can show it. When a tumor blocks the bile duct, bile builds up and makes the gallbladder or liver bigger. About 15% to 20% of people with pancreatic cancer may show signs of it. While not all cases of enlargement indicate cancer, those accompanied by symptoms such as jaundice or abdominal pain should be investigated further. Early detection through imaging and consultation with a healthcare professional can provide important insights into the underlying cause and guide appropriate treatment strategies. Unexplained blood clots, especially in the legs, can sometimes be the first sign of pancreatic cancer. This condition, known as deep vein thrombosis, DVT, affects approximately 10% to 20% of pancreatic cancer patients. The clots can cause swelling, redness, and pain in the affected limb. Pancreatic cancer increases the risk of blood clot formation due to the release of procoagulant substances by the tumor, altering the normal balance of blood clotting. While DVT can occur for various reasons, its presence alongside other symptoms like weight loss or jaundice should prompt immediate medical evaluation. Finding and treating blood clots as soon as possible is very important to keeping complications from happening. They can also help find hidden health problems like pancreatic cancer. Odd fatty tissue abnormalities or skin rashes might also be linked to pancreatic cancer. These manifestations, known as eruptive xanthomas, can appear as yellowish, itchy bumps on the skin and are a result of changes in fat metabolism caused by the cancer. Approximately 4% to 10% of pancreatic cancer patients may experience these symptoms due to the tumor's impact on the pancreas's ability to manage fat digestion. The presence of these skin changes, especially when accompanied by other signs like unexplained weight loss or jaundice, should not be overlooked. Consulting with a healthcare professional for a thorough examination and possibly a biopsy of the affected tissue can help determine the cause and whether it's related to pancreatic issues or another condition. Sudden changes in skin and eye color can be alarming indicators of underlying health issues, including pancreatic cancer. A notable symptom is the development of jaundice, characterized by yellowing of the skin and the whites of the eyes. This occurs when the liver can't process bilirubin due to a blockage caused by a pancreatic tumor. Beyond jaundice, some individuals may notice a deeper bronze coloration of their skin, unrelated to sun exposure. These color changes, especially when accompanied by other symptoms like abdominal pain or weight loss, should prompt an immediate consultation with a healthcare provider. Recognizing these signs early and seeking medical advice can be among the most important steps in diagnosing conditions like pancreatic cancer at a more treatable stage. Persistent indigestion, gas, and bloating that don't go away with usual treatments can be a warning sign. Around 30% to 50% of individuals with pancreatic cancer report experiencing these digestive symptoms. The tumor's location in the pancreas can affect the release of enzymes necessary for food digestion, leading to uncomfortable digestive disturbances. It's important for individuals experiencing these persistent digestive issues to seek medical advice. A healthcare professional can conduct tests to determine the underlying cause, which, if identified as pancreatic cancer, can lead to early intervention and potentially more favorable outcomes. As we've explored these 12 unusual signs of pancreatic cancer, it's clear that early detection is crucial. Understanding and recognizing these symptoms can lead to an earlier diagnosis and significantly improve treatment outcomes. Now I'd love to hear from you. Were there any signs that particularly surprised you or that you were previously unaware of? How has this information influenced your perspective on the importance of listening to your body's signals? Remember, your health is in your hands, and staying informed is key to early detection and prevention.